Okay, so I'm gonna do my presentation over Australian Shepherds, because I love them, obviously. I'm a college student with 2 dogs. And so the Blue Merle is Apollo, so he's the one cuddling Olaf. So right here. And then this is Midas, he is the Red Merle. So they come in different colors, like I said. So you've got the Blue Merle, which has the distinctive colors of like the bluish, the gray, the black, and the brown, kind of all mixed together in a dappled pattern. And then same for the red, but they're all in different shades of brown. And yes, they do love the laser pointer. There's also, they come in 2 other colors, so they have the black tri and the red tri. And so the black tri, there's no spattered spackles or anything like that. There's a little bit on his nose, you can see right there, but usually that's about as much as they'll get with the black tri. And then with the red tris, they're very distinctive, no dappled patterns at all. So just like border collies, like she talked about last week, they have some similar problems, but not that many problems. So we've all talked about hip dysplasia a lot, and we talked about how they can correct it. The only other thing that I haven't heard of yet was an FHO surgery, and that's when they actually take the head of the femur off. And because of the tissues and tendons around, it'll actually keep that bone in place, and they're still able to move regularly. Usually if they do the FHO surgery, they advise that they don't be hurting dogs, just because of when they cut and everything like that, they can end up ripping something because they don't have that ball and socket joint like they used to. They also have some eye problems, so they're really prone to glaucoma, which is when the eye gets really cloudy, and they can end up going blind like that. They also have sensitivities to certain, which I misspelled certain, sorry, certain drugs. So ivermectin, acepromazine, and butorphanol. So acepromazine is like a sedative, where butorphanol is kind of like a pain management type thing. I put this up here because it's kind of a fallacy. So a lot of people think because herding dogs are sensitive to ivermectin that they can't have heartworm preventative. That's wrong. So it's more of at a higher dose. So the reason they always put sensitivity to ivermectin, because they are herding dogs, and so they most likely are around cattle, sheep, pigs, horses, and when you have to give them ivermectin, like Ivermec, Corded, and something else, I forget, but when you give them that, they're usually in drenches or in paste, right? So they have a chance of eating that, and their parts per million of ivermectin and theirs is way different than this parts per million. So if you do have a herding dog, yes, they can have Heartgard. That's what I give my dogs. They do great on it, so they haven't had any trouble.
That's an excellent point, because it's really, because you can have a dog, and if they get into the package, they can eat 2 or 3 or 4 months worth, and usually it's not a problem. But these things are a higher concentration for livestock, and that's what they're referring to. Excellent point. Yeah.
And then also, like she stated with the border collies, they are prone to getting epilepsy. They don't really know why. They're thinking that it's a genetic thing. And they see it more too. I'll talk about it later about like double Merles. That's just kind of a bad thing, and they'll see that more coming up if you do that. So breeding is a big thing. These guys, I actually did research for about 2 years to find a really good reputable breeder. I ended up finding one in Sparta, Tennessee, so it's about 11 hours from here. The lady was a registered vet tech, and her dogs, when I went out there, she had all dogs on site. Their dogs lived like kings. Like her house, they lived better than she did, I feel like. But they had all of them on site. She has all of them OFA, so this is the Orthopedic Foundation of Animals. So they will end up doing, this is where they check their hips, elbows, even sometimes knees. So what they'll do to check that is so this is called a VD, so this is where the x-rays will go from ventral to dorsal, so the dog is laying on its back. And so that's how they can do the hips and the knees, if they need to do the knees. And then to do the elbows, they'll just do a lateral, so they'll label it right or left, which way the dog is laying, and where the laser is going on. You'll usually have like an R or an L in your picture, but they'll just make sure that everything is in socket, no abnormalities, stuff like that. And then they'll rate them, so they'll be all the way from really, really good, so very good, all the way down to very poor. You don't want a very poor dog. But also vaccinate. A big thing is breeders usually should do the first round of vaccines for them. So puppies will get 3 rounds of puppy vaccines, so usually around 5 weeks, at least this is what we do where I work at, is usually 5 weeks, 8 weeks, 12 weeks, and then they get their adults at 16. So they'll have 3 puppies, and then they'll get their adult. Usually the breeder will do the first round. The lady that I got them from, she kept them for me longer because I was still in school, so she actually did their second round for me and didn't charge me at all. So, and then they also need to have their dew claws removed. I say this, they have to, just because she uses them as show dogs, and so if you're going to be showing them, they do not like having their dew claws at all, just because nowadays they don't need them, so AKC sees them as kind of just not needed. So they like them taken off. So you usually do their dew claws, and then they also want their tails docked. So I took a picture of their butts because they got their tails docked. They usually have to do those between, humanely do it between 2 and 5 days after being born. Just kind of like with people when you get a baby circumcised, they usually do it within the first couple days.
Why don't you point out where the R should be on the radiograph and the L?
So this is a VD, so we don't usually label VDs. We've never labeled VDs just because the dog's on the back, but like if the dog's laying on its right side, so.
But what would be here, right on that? What would you type in?
If it was
R.
laying on its right side, then like this is its right side, right?
Yeah. Mhm.
Then we would put an R.
Yeah.
I have to look at it.
Dorsal,
You have to look at yourself, and then yeah.
It's in
so,
dorsal recumbency.
yeah.
So
So
that's
here's your
R,
right.
And that's
Here's your left.
And the dog
so,
is jumping up on the screen.
Yeah, he loves the laser pointer. So that's a good thing that you should look for breedings. And then the one big thing about breeding is do not breed double marrows. And Apollo is telling you. He looks very angry. Do not breed double marrows. And here is the reason why. So this number has gone up within a couple years, but when you breed double marrows, you're passing on a gene mutation, MDR1, and because you're passing on this mutation, you are going to have a dog that's mostly white, so he's not going to have very much pigment at all. And unfortunately, they say 25% in this picture, but now they're thinking more of 30 to 35%. They have chances of being blind or deaf, and they'll even have very, very small eyeballs that don't completely develop. And the problems with that, this person decided to keep the dog's eyes even though the dog is completely blind. A couple of veterinarians that I've worked with have decided to actually just enucleate the eye and suture it because they're scared because the dog is blind and it can't see anything, that it may dig its head into somewhere and get stuff all in the eyeball, and it's not going to know because it has no feeling or anything in that. So they would rather take the eyeball out and just suture it up. So yeah, please don't breed double marrows. It's not fun. It's not a good thing. I know it'd be cool to have a cool like white Aussie, but all right.
Questions? You ready? Any questions, comments? You were going to ask the audience.
I am going to ask the audience. So another big problem that I didn't talk about with Australian Shepherds is barking. So they are supposed to bark because they're herding dogs, and that's how they get the sheep's attention, stuff like that, to make them go a different way. I have had a really big problem because they are in, I use them around the horses, so I want them to bark then, but with people, you guys saw, barked at Griff, right? Barked at him. I have tried everything, and I have read forum after forum after forum saying that that's just Aussies, you're not going to stop them from barking. Anybody have a remedy? Because I've tried everything, and I don't like using this bark collar. Because he figured out the bark collar in 5 minutes. So, he just barks at a lower tone, it doesn't shock him. Yeah. So, if you guys have any
Anybody have
suggestions.
suggestions an hour later? There's maybe a comment or question.
Yeah.
You probably tried this, but my Aussie, he had a long cloth muzzle that like kept his nose open in the front, but it kept his mouth closed enough that he could only like make like a boofing noise.
Are you talking like a gentle leader?
No, like an actual muzzle.
An actual
for,
muzzle?
like grooming or stuff.
Okay.
Yeah.
Yeah, that we only had it on if he was like barking at guests, but like that really reduced his noise output.
Okay.
Yeah. The only thing is you can't leave that on when you leave.
Mm.
Yeah,
Because they
and
can actually like.
Yeah.
They can't pants or anything with it on.
Yeah.
So if they get too worked
so
up.
that's a good point. That's
That's
terrible
right,
if they can't
okay.
pants. Yeah.
yeah, because he's okay, but I like.
Now, how
This is
old
when
is
you're
he?
gone,
How
right?
old is he?
No, mine just barks when I'm gone, but I'm trying to I'm fixing him on that. But Apollo barks at people, especially just when he first meets them.
And how old is he right now?
He's 2.
Oh, he's 2. I was going to say, is he going to grow out of it?
Yeah,
Probably
no,
not.
I thought he would, and I've tried, but he hasn't. But he is 2, and it gets to the point.